Hi, today we will be debunking myths of mental illnesses with the help of
Dr. Dog
and
Mr. Yang.
we will be talking more about these myths. Dr. Dog, I heard that psychiatric disorders are not true medical illnesses, like heart disease and diabetes. People who have mental illness are just crazy.
Well, brain disorders are like heart disease. They are legitimate medical illnesses, and research shows that there are genetic and biological causes for psychiatric disorder, and they can be treated effectively.
Dr. Yang, is it true that people with severe mental illnesses are dangerous and violent?
Well, statistics show that incidence of violence in people who have a brain disorder is not much higher than it is in general population. Those suffering from a psychosis such as schizophrenia are more often frightened and confused than violent.
So, Dr. Dog, is mental illness the result of bad parenting?
Well, most experts agree that genetic susceptibility combined with other risk factors lead to a psychiatric disorder. In other words, mental illnesses have a physical cause.
So, Dr. Yang, does depression result from a personality weakness or character flaw? And with people who are depressed, could they snap out any moment if they try hard enough?
No, depression has nothing to do with being lazy or weak. It results from changes in the brain chemistry or brain function. And medication or physiotherapy often help people to recover. Meh.
Thank you, Mr. Yang. Dr. Dot, I'm confused. Does schizophrenia means split personality and there's no way to control it?
Actually, schizophrenia is often confused with multiple personality disorder. Schizophrenia is a brain disorder that robs people of their ability to think clearly and logically. Medication has helped many of these individuals to lead fulfilling and productive lives.
Dr. Yang, is depression part of a normal aging process?
Well, it's not normal for older adults to be depressed. Signs of depression in older people includes a loss of interest in activities, sleep disturbances, and lethargicness. Depression in the elderly is often undiagnosed, and it's important for seniors and their family members to recognize the problem and seek professional help. Man.
Dr. Dot, I heard from a friend that depression and other illnesses such as anxiety disorder do not affect children or adolescents. Any problem they have is just part of growing up. So, is it true?
No! Children and adolescents can develop severe mental illnesses. In the United States, 1 in 10 children and adolescents have mental disorder severe enough to cause impairment. If it is left untreated, these problems can get worse. Anyone talking about suicide should be taken very seriously.
Dr. Sheep, does it mean that if you use your own willpower, can you by your own means get rid of mental illnesses? And does it mean that being treated for psychiatric disorder means that individual has some way failed or is weak?
A serious mental illness cannot be willed away, and ignoring the problem does not make it go away either. It takes courage to seek professional help too.
Dr. Zob, does addiction show a lack of willpower, and is it a lifestyle choice? And people who abuse this substance, are they weak or bad?
Actually, addiction is a disease that generally results from changes in brain chemistry. It has nothing to do with being a bad person.
Dr. Sheep, I heard that electroconvulsive therapy, ECT to be short, was also known to be as a shock treatment, and it is very painful and barbaric. Is that true?
ECT has in fact given a new lease on life to many people who suffer from severe and debilitating depression. It is used when other treatments such as psychotherapy or medication fail or cannot be used. Patients who receive ECT are asleep and under anesthesia, so they do not feel anything at all.
This concludes our session of debunking myths of people with mental illnesses. I would like to thank you for watching the video, and I hope you have learned something out of it today. This is Gareth.
This is Doc.
This is Dr. Yang. Meh.
Signing off.